I keep seeing the same promise packaged 3 ways. Eat fish, take fish oil, become sharper, calmer, leaner, and basically waterproof. Is fish actually that powerful? Or is the real lesson more boring, like choose the right species a couple of times a week?
The non-magic version is still useful. Fish can bring high-quality protein, EPA and DHA omega-3 fats, and depending on the fish, vitamin D and minerals. But the benefit is not a spell cast by seafood. It depends on what fish replaces, how often you eat it, how it is cooked, and whether that species carries more contaminants. Mechanistically, EPA and DHA ride in with dietary fat, get packaged into lipoproteins, and are delivered into cell membranes. There they can partly replace arachidonic acid-rich fats and influence inflammatory signaling. That is why trials often measure ratios like EPA to arachidonic acid. It is a plausible pathway, but a better blood ratio is not automatically a better knee, brain, or heart outcome.
That biomarker point feels important. If a product raises EPA in blood, people may assume they will recover faster or perform better. Do we have evidence that higher EPA after fish oil actually changes something you can feel?
One recent small trial is a good compression of the issue. Healthy young men took oils providing 600 milligrams EPA and 260 milligrams DHA daily for 8 weeks. A structured triglyceride form raised the EPA to arachidonic acid ratio more than a physical mixture, but did not beat the comparator for leg extension repetitions or fatigue measures after resistance exercise. Fish protein has its own lane. A salmon-derived protein peptide was compared with whey and carbohydrate after muscle damage. Extra high-quality protein looked modestly helpful later in recovery, and salmon peptide was not inferior to whey, but most outcomes did not separate cleanly. So the practical win is adequate protein, not a secret salmon recovery switch.
So, if the benefit is real but not magical, the next question is safety. When someone says, just eat more fish, what should they do about mercury, especially if they are pregnant, feeding a child, or eating tuna constantly?
The contaminant story is a gradient, not a red stamp on all seafood. Mercury bioaccumulates up food chains, so large, long-lived predators generally deserve more caution. Smaller, oily fish can give EPA and DHA with a different exposure profile. Regional monitoring matters too. A North African coast meta-analysis found trace element levels varied substantially by country, seafood category, and fishing zone.
If I am standing at the store, what is the practical hierarchy? Am I looking for wild salmon, farmed salmon, sardines, canned tuna, white fish? Or does the best answer depend on what gap I am trying to fill?
Exactly. For omega-3 density, oily fish usually make more sense than very lean white fish. For lean protein with mild flavor, white fish can work well, but it may not deliver much EPA or DHA. Canned fish can be practical, but the label matters. Sodium, serving size, added oils, and whether it is a higher mercury tuna pattern versus lower mercury options. Fish oil is narrower than fish. It can raise omega-3 biomarkers, and some specialized medical contexts study concentrated formulations, but does not bring the same food matrix, protein, satiety, meal replacement, or the chance to displace processed meat. Also, supplement trials in complex settings, like chemotherapy, remain preliminary and inconsistent for clinical outcomes.
When should someone not freelance with concentrated fish oil? I am thinking about people on blood thinners, people having procedures, cancer patients trying to stack supplements, or anyone using capsules as a substitute for medical treatment.
For most people, the practical pattern is food first. Choose fish you can repeat, prepare it in ways that do not bury it in deep-fried breading or huge sodium sauces, and rotate species. The goal is a sustainable habit that improves the whole plate, not a heroic tuna streak or a capsule chase after a low-quality diet. There is also a future-facing wrinkle. A large meta-analysis on warming and acidification found ocean warming can reduce omega-3 fatty acid proportions and concentrations across marine organisms, with big effects at the base of the food web. That does not change dinner tonight, but it explains why sustainability, aquaculture feed, and nutrient monitoring are becoming nutrition issues, not just ecology issues.
Can we name the people who need a narrower answer than fish is healthy? Pregnant people, kids, fish allergy, local catch advisories, heavy can tuna habits, and people using supplements around treatment all seem like they need more than a slogan, right?
Right. The clean takeaway is not eat fish every day or avoid fish because mercury exists. It is use fish as a targeted food. Pick lower contaminant species often enough to matter. Match oily versus lean fish to your goal. Keep preparation simple and treat concentrated oils as products with boundaries. The best fish choice is the one where the nutrient upside survives the species, label, and context check.